is Ashley Okosa, and I am the research editor and co-founder of Maternal Figures. Globally, the maternal mortality ratio has reduced by about 38%. Despite that, Nigeria still accounts for almost 20% of the global maternal health burden. Maternal Figures is trying to answer two questions. By 2030, Nigeria, to meet the Sustainable Development Goals, Nigeria would have needed to reduce its maternal mortality ratio by 80% in less than 10 years. The questions we're trying to answer are, one, will Nigeria meet that goal? And if it does, how will it meet that goal? If Nigeria does not meet that goal, why? The problem that we're trying to address is that there's little to no access to quality information on maternal health outcomes in Nigeria. We all read the newspaper and we see government programs that have been implemented to reduce maternal deaths or funding from international organizations like USAID or DFID, again, trying to reduce maternal deaths in Nigeria. The problem is that we don't know what the outcomes are. We don't know what happens after the funding announcements have been made and after these programs have been implemented. Do they work or do they not? In a survey for health journalists we conducted in 2019, we found three main issues that affect the quality of maternal health reporting. One, no access to current and updated public health data, low funding for local reporting, and very few training resources. Our solution is Maternal Figures, a searchable interactive database of maternal health interventions funded in Nigeria over the last 30 years. Our public access database contains over 150 fact-checked, high-quality information on maternal health projects implemented in Nigeria. While our starting point is Nigeria, our current technology is scalable to other parts of the world. Our target audience includes journalists in Nigerian and international newsrooms, academic researchers and graduate students in institutions, health policy practitioners, families looking for care in their locality, and general citizens seeking government accountability. On Maternal Figures, our website, we've built an MVP where users can search over 150 interventions by location, funder, type of intervention, or stage of maternal health care. Users can see important details like funding the project has received, contact details, as well as previous journalistic reporting on this project. Users can even see which funders have funded the most amount of projects in their region. It's all searchable, it's all interactive, and it's all free. Since we launched our MVP in 2020, we've had almost 20,000 unique page views. 65% of these have come from organic search on Google and search engines. We found that users are finding our website because they're searching some of these large government programs, and we are one of the first hits because there's no other place where comprehensive access to this kind of information can be found. Users are spending about 4 minutes on our platform, which is higher than the 1.82 minute average for news sites, according to Pew. We've been referenced in 2 journal articles, and more than 10 publications have referenced our data and our resources. We really don't have direct competition. We're not a newsroom, so newsrooms aren't really our direct competition. In fact, we are aiming to work more closely with newsrooms by making our data more available to them. Our indirect competition would be considered health organizations or the government who can actually release this information and make it more accessible if they choose to. Some of the factors that might affect our operations include government policy. If they decide to change the way they make this information available to people, that could affect how we then operate. Economic factors include if the tide in terms of funding on maternal healthcare changes, if the government agencies decide to fund less maternal health programs or international agencies. Some of the other social factors are ease of the use of our platform. Even though we created this with journalists in mind and researchers in mind, we believe that anyone should be able to access this information easily. Which also brings me to the next point, internet bandwidth to load the platform. That is also something that we've taken into consideration. And the final factor is legal. When we think about, we access a lot of this information from government websites, from donor websites, and the accuracy of this information is also something that we need to keep in mind. I want to focus on 2 things here. Our unique value proposition and our competitive advantage. There is no other platform in Nigeria that offers 3 decades worth of contextual reporting and historical information about one of the country's most pressing health issues, That's where we come into play. Also, with the model that we've created, this can be applied to any other social issue anywhere else on the continent. Our timelines include we launched our MVP in 2020, and we've received a number of page views and interactions so far. We funded fellows who have continued to use our platform to produce journalism about maternal health. In 2021, we developed an open platform, or an open source program, actually, where anyone can learn how to report on endemic health issues using solutions journalism. And we used our platform as an example. We joined the Jamlab Accelerator, and we added more projects to our database. We also received funding from the Pulitzer Center to continue our reporting on these maternal health programs. Our goals for this year include expanding our fact-checking, software development, and partnerships team. Our goal is to expand the fact-checking team to increase the number of programs we have in our database, expand our software team to also begin to try new models of how people interact with our website. Who are some of the other members that we're trying to reach, and what are the ways that we can create models for them to interact with our website? And also a partnerships lead in order to help us continue to create partnerships with not only newsrooms, but academic institutions and others who find the information we have on our platform useful. Also, by the end of this year, we hope to achieve 2 times our growth, develop publishing relationships with at least 3 newsrooms, and publish a white paper on the data perception among journalists in Nigeria. By 2023, we hope to expand to a different African country, and to also launch a membership program for tiers of users on our site. Again, this is our team. It's a very lean team, but we work incredibly hard. I'm Ashley, like I mentioned at the beginning, I am the research editor, and I work with the journalists and other newsroom partners. Chumasuzu is the product manager, and he's responsible for the data research on our site and the product management of our platform. Our collaborators and partners over the last few years include the Brown Institute for Media Innovation, Solutions Journalism Network, Code for Africa, Nigeria Health Watch, and Medan. This is our cost structure so far. A large percent of our costs go to personnel, and will continue to go to personnel as we expand our team. Product development is also important, followed by administration and miscellaneous costs. Our goal is that in 5 years or even less, we will be able to grow our partnerships and then also continue to collect data from different kinds of countries on whether it's about maternal health or other topics of other social topics. By 2023, we hope to be able to answer the question that I posed at the beginning. Will Nigeria meet this goal? If yes, how will it meet this goal? And if not, why did it not meet this goal? Thank you so much.